Do you have to get out of bed to use the restroom 2, 3, or even 4 times a night? This frequent disruption is a blatant indication from your prostate and isn't merely interfering with your sleep. After the age of 60, every doctor's office should have a vital discussion regarding your prostate, but it hardly ever does. Your prostate health can be completely transformed by 3 easy daily behaviors rather than more medications or invasive surgeries. Although most men are unaware of these practices, scientific research has shown that they can be more beneficial than many pricey treatments. I'm Jaine, a urologist with more than 20 years of expertise, and I'm here to finally talk to you about it. Keep reading because I'm going to reveal something that could alter your life for the rest of it, and I guarantee you'll be surprised by the third habit. You must rapidly grasp why this is important if you want these 3 behaviors to make sense. Imagine your prostate as a walnut-sized gland that sits directly behind your bladder. The important thing is that it forms a ring around your urethra. This gland begins to expand over the years as a result of normal hormonal changes. Additionally, that growth starts to compress the channel because it encircles the urethra. This is really common and is like stepping on a garden hose. More than half of men are already experiencing the impacts by the time they are 60. That figure rises to 70% by the age of 70. That's why you may recognize those symptoms all too well. The inability to start urinating, a weakening stream, the sensation that your bladder never completely empties, and of course the frequent toilet visits that ruin your sleep at night. The most crucial aspect, which the majority of guys take for granted, is this. They believe this to be a normal aspect of aging. The startling reality is that you are not required to take this as a given. In many cases, these problems can be prevented and even reversed with natural, scientifically established methods. And I'm going to demonstrate how to do just that for you immediately. First, let's talk about the first habit. Okay, so we all believe we understand the first habit, but I can assure you there's more to it than that. I refer to it as smart hydration. Dr. Jaine, I understand what you're probably thinking. Drinking water? Really? Really, yes. However, when you drink water is more important than how much you consume. And that distinction is important. Let me give you a quick explanation. Your pee gets extremely concentrated when you don't drink enough water. It becomes overloaded with chemicals and poisons that actually irritate your prostate and bladder, leading to inflammation and exacerbating all of the symptoms we've discussed. The secret that most people don't realize is that time is crucial. The plan is straightforward. The morning and afternoon are the best times to consume the most water. Reduce substantially after 6 p.m. If you're thirsty, take few sips at most. This keeps your prostate hydrated and content throughout the day. Most significantly, you rest your bladder during night. And I'm not the only one who says this. Men who adhere to this hydration schedule report a 40% decrease in midnight restroom visits, according to studies. Consider the implications of that. Deeper, more restful sleep. Your quality of life can be radically changed by making one small adjustment. Let's move on to the second habit, which you can begin forming right now. We've already discussed hydration. Let's go on to a habit that is so easy you may question it. Don't, however. The strategic walk, as I refer to it. Right after your main meals, I'm referring to a quick, easy stroll that lasts only 10 to 15 minutes. It sounds too easy to work, doesn't it? However, the science underlying it is quite potent. This is the offer. Your blood sugar levels rise each time you eat. Blood sugar rises can be avoided by taking a little walk immediately thereafter to assist your muscles use that sugar as instant fuel. Indeed, a 15-minute walk after each meal was found to be more beneficial than a 45-minute walk at regulating blood sugar levels throughout the day, according to a study published in the esteemed journal Diabetes Care. The important question now is, how does blood sugar affect your prostate? Everything. Chronic inflammation spreads throughout the body as a result of frequent blood sugar increases. Furthermore, persistent inflammation is now recognized by scientists as one of the primary causes of prostate development, hyperplasia, and an elevated risk of more severe problems. Therefore, you are not only strolling when you do this easy walk. With each step, you're actively preventing inflammation at its root, safeguarding your prostate and enhancing your metabolic health. The walk doesn't have to be strenuous. After lunch or dinner, a leisurely walk around the block is plenty. Long-term benefits to your prostate health will outweigh the short-term cost. Let's move on to the third and most unexpected habit. Now that we've arrived to the third and most unexpected habit, I must treat it with the gravity and deference it merits, as I am aware that silence surrounds it for many men. As a physician, I refer to this as natural prostate cleansing. The science presented here is straightforward and comes from Harvard University, one of the top authority in the world. Researchers tracked more than 30,000 males for over 20 years in a historic study. The outcomes were revolutionary. According to their findings, those who ejaculated more frequently, roughly 21 times per month or more, had a 33% decreased chance of getting prostate cancer. Although 21 times a month may seem like a lot, many people find it to be a regular and healthy frequency. What makes this work then? The explanation is straightforward and fascinating. The prostate is cleansed by regular ejaculation. Consider it an internal purification. Every time, you're assisting in the removal of old secretions, dead cells, and any toxins that can accumulate in the gland and eventually result in irritation or damage. And I must be really clear here. According to the Harvard study, the frequency of ejaculation, whether done with a partner or through masturbation, is what provides the health benefits. I am fully aware that this is a sensitive subject for many men, particularly those without a committed relationship. But I want you to know from a purely health and medical standpoint, at any age, this is a perfectly natural activity that has been shown to improve prostate health. I urge you to have an honest conversation with your urologist if this subject bothers you. There should be no judgment because this is a health discussion. Now, it's important to comprehend the connections between these three habits. And finally, a crucial caution, not as a content producer, but as your physician. Nothing at all that we've covered here can take the place of your urologist's yearly examination. Digital rectal exams and PSA tests are essential tools for men over 60. Your best chance of receiving appropriate treatment and living a long, healthy life is early detection. Don't overlook this, please. Ultimately, maintaining your prostate means maintaining your quality of life. It makes the difference between a third age that is full of activities, independence, and vibrancy, and one that is characterized by restrictions and discomforts that you really don't need. And I'm sure this works. For me, this goes beyond medical theory. It's the tangible outcomes I witness in my patients' lives on a daily basis at work. I observe men who have embraced these basic habits and experienced remarkable progress. However, I am aware that many of you are seeking quicker outcomes or are coping with symptoms that are already causing you a lot of trouble. In those situations, it is crucial to address inflammation, the underlying cause of the problem, more directly. For this reason, I would like to share a breakthrough finding that I have been suggesting to my patients. In just a few weeks, this easy 15-second male nighttime practice has demonstrated remarkable effectiveness in reducing prostate enlargement and relieving the most annoying symptoms, such as frequent dribbling and urgency to use the restroom. This approach has the advantage of working naturally rather than requiring costly drugs, which, as we all know, can have a long list of undesirable side effects. Unfortunately, because they don't bring in as much money for the large pharmaceutical business, natural remedies that work like this don't often receive the attention they deserve. Therefore, I've prepared a brief video presentation that explains exactly how this ritual works if you're genuinely annoyed that you can't sleep through the night or embarrassed by your frequent bathroom breaks. Both the description underneath this video and the first comment have the link pinned. I'd like to hear from you now. Please leave a remark below. Out of these three habits, which one surprised you the most? Which will you start today? This is the spot to ask any queries you may have. I personally read as much as I can and reply as much as I can. Additionally, tell me where nation or city you are viewing from. I enjoy interacting with each of you. The best way to show me that you appreciated this video is to hit the like button and subscribe to the channel. Remember to turn on the bell so you don't miss our upcoming men's health films. Finally, and perhaps most importantly, please spread the word about this film. Give it to your father, your son, your sibling, or a friend. When presented at the appropriate moment, high-quality knowledge like this can genuinely change someone's life. Click the video that appears on your screen right now to learn more about the foods that are greatest for prostate health and to take even better care of your health. Remember that your health is your most valuable possession, and I'll see you in the future video. Look after it.